My name's Dr. Monica Handa and I'm the principal chiropractor here. I have been here working for many years and what I'm going to be sharing with you is some simple tips and things that you can do that we know work. So before we get started, firstly I'd like to thank all of you for turning up today, because one of my coaches' favourite sayings is, partly the secret to success is actually showing up to something. What's easy to do is easy not to do. But my commitment to you this evening is that you're going to be learning more about natural approaches to fibromyalgia management. Who's interested in that? Hopefully all of you. And then there's some simple dietary tips that we also know definitely work too. Mindset strategies that everyone with fibromyalgia should definitely be taking on board, and the side effects of fibromyalgia medications. We're going to run through some of those as well with you. And then one of the major things that we'll talk to you at the end about is an effective strategy for managing fibromyalgia as well. So since as we're going to be spending a little bit of time together this evening, I'm going to let you know why it is that you should listen to me. Okay, so I've already made a brief introduction for myself. So I've actually been in the practice here, in clinical practice here for 32 years, and I've been in this same place for that period of time. And over that time frame, I have taken care of thousands of patients with increasing regularity, those that have fibromyalgia or a diagnosis of fibromyalgia. So a few different new approaches to fibromyalgia is we need to know where we're coming from. So does anybody in the audience here know what percentage of the UK population is currently diagnosed with fibromyalgia?
Is it that one?
We have 11 here. Are we going to go do a little? 25%? 52?
I'd say a lot.
A lot. Okay. Any other numbers out there? Higher or lower than 52 or 11? No? It's under 5% of the population. Yeah, it's under 5% of the population. However, those are people that have had a formal diagnosis, right? So you may know a lot of people that have similar sort of symptoms as what we classify as being fibromyalgia, but they may not have had a formal diagnosis. So how many of you who've had a diagnosis of fibromyalgia have been given a reason for the cause of it?
Glandular fever.
Great, yeah, so that is definitely a thought process as to the fact that you have had something that was pretty virulent that has attacked your system and it's left you compromised, which is why it is that you're now suffering the way that you are. Having said that, not everybody that has glandular fever then goes on to develop fibromyalgia. Okay? Anybody else been given a...
Not been given one, but I believe it's trauma.
Okay?
Yeah, pneumonia as well.
Pneumonia.
I have an autoimmune disease.
An autoimmune disease, yeah? Anybody got anything else?
I've got lupus.
Lupus, yeah. There are two other forms of stress that actually get overlooked, which is physical stress and chemical stress as well. So when we talk about stress, that's synonymous in our minds with emotional or mental stress, okay? But there are two other forms of stress as well, which is physical and chemical as the main ones. We know that you have a cycle of pain that is not the same as somebody else who has the same issue. So like for yourself, you know that you had glandular fever, and as a consequence of the glandular fever, you have then been left with an issue, okay, which has left you compromised. We've talked about immunocompromised individuals here already, okay? So we know that that is definitely something that can happen, but it's your reaction to the trauma that is heightened. Would we agree with that? In comparison to somebody else who may have gone through exactly the same situation. Are we following me with regards to that? So do we know why that may happen? Okay, so some people think that there may be a genetic predisposition towards that, but it's very easy to blame everything on your genes, and your genes actually haven't changed much in like hundreds of thousands of years. So we've then got to think about potentially a different theory. So this goes for many, many other conditions as well, is that it's really easy to say it's your genes. Why do you think it's easy to say it's your genes?
Because they don't know why.
Because number one is because they don't know why, but number two is that then kind of removes all responsibility for anybody to be able to do anything, because it's just the way you are. Does that make sense for everyone as well? So the problem that we've got with the current approach, which is, what is usually the current approach for anybody that has fibromyalgia these days? Yes, medication. Okay, and what are the common medications that someone may take? Gabapentin. And what's gabapentin actually for? Anyone know? It's an anti-epileptic. So, you've got fibromyalgia, you get put on gabapentin, but it's actually an anti-epileptic. How's that going to work for
Is
you?
that the same on pregabalin as well? Yeah.
Naproxen is an anti-inflammatory. Yeah. Amitriptyline, yeah. So morph, anything with morph is obviously a morphine, and morphine, as we know, is highly addictive. Okay, so we also have most people that are not just on one medication. You're usually on more than one. Why would you end up on more than one medication?
Because they don't know what it is.
Number one, they don't know what it is, but number two is something may not be working, okay? So it could be that, but one of the main reasons that a medication won't work is because it's not for that, okay? So you know, that's what, so I don't have a problem with medication used in the right context. But if you're giving somebody who's got fibromyalgia an anti-epileptic medication, that doesn't compute to me. Okay, it's the same as somebody who's given, morphine. So what does morphine do? You know, how does morphine work within your body? It's a painkiller, but where does it work? On your brain, right? So what does it do to your brain? Sends you crazy, yeah, there is that. It's addictive, but what else does it do? What does it do to your brain? Numbs it, exactly right. So you actually then, but the problem with the morphine related products is, number one, you develop that addiction because the time frame that it works for reduces and reduces and reduces. Anybody watch those Netflix series about the medications, etc.? Yeah, they're definitely worth watching because of the fact that, I'm not saying that they're 100% true, but there's definitely an element of truth within them, okay? So, morphine, it's addictive. It numbs your brain. What else might it do to your body? If it's numbing your brain, it's numbing your brain. It's not just numbing your brain to your pain.
Nervous.
It numbs you in general. Yeah? So you don't have the perceptions and the awareness, and then a lot of people will say that I don't feel like me anymore, because of the fact that you're on a medication that, you know, that you shouldn't really be on, in my opinion. So I'm not saying that you need to stop taking the medication, because that's not where I'm not in a position to be able to do that. But what I am saying is maybe there should be a little bit more questioning about the medication that you're on. Okay? Is it the most appropriate thing for you to be doing? Is it the most appropriate thing for you to be taking? So we know that we're very, very lucky to have an NHS. Who agrees with that? Yeah, absolutely. So all of us have had a use for the NHS for whatever reason. So it's either ourselves or a loved one that's needed to use the NHS. What the NHS is not fantastic at is dealing with these type of issues. Anybody in agreement with that? Yeah? That's why you're sat here. So we know that medications and the NHS are brilliant for emergency situations. Like if you've had an accident or a fall or a trauma or an attack, you know, like a whatever, you know, heart attack, whatever, you know, that isn't the time that you then go for a natural approach. That's where it is that you want to end up in the hospital, because you're going to be taken care of appropriately and brilliantly as well. Most of us have that experience, I would say. So we know that we don't want you to stop taking the medication, but we want to look and see, are there other ways which we can actually approach the situation. So we've talked about trauma, and you talked about like it being an emotional trauma or a childhood trauma even maybe. Has anyone heard of that as a concept? Yeah? So there are, but when you went to your GP or wherever you've been for your diagnosis of fibromyalgia, was that considered, and were you talked to about resolving the situation from that perspective?
No.
Okay, so there are counselling sessions that you could have done which will help you with that for sure. That's what we call a mental and emotional situation, okay? That trauma that we've talked about. Nutrition does play a part, so you asked me what chemical stress is, and an imbalance in the correct things that are required within your body would create something called a toxicity, which means you've got too much of something, or a deficiency, which means you've not got enough of something within your body. Does anybody know what the most common thing is, which you talked about just before, about the medication that you're taking? What is the most common thing that occurs with any disease process, but particularly with fibromyalgia? Why would you take naproxen if you've got fibromyalgia? Anyone know?
Anti-inflammatory.
It's an anti-inflammatory, so what does that tell you about fibromyalgia? There's a lot of inflammation. Okay, so anybody want to take some notes? Now would be the time for you to be looking at taking some notes, because I'm going to talk to you about the things that you can potentially do to help reduce that inflammation.
Can I ask you a question?
Okay?
So when I was in the process of being diagnosed, I was taken off all, because they were treating me for polymyalgia.
Yes.
I was taken off everything.
Mm-hmm.
And I was told that polymyalgia shows us inflammation in the blood.
Mm-hmm.
Then fibromyalgia doesn't, because it's not inflammation.
Okay.
So now you're going to
Dispute that. Yes, I am. Okay.
That's fine.
So I think what happens in that circumstance is it depends upon the degree. That's all it is, you know, because I think, you know, with places like the NHS, they have like, you know, if let's just say that for you to have inflammation, you have to be at 51, and for you to be diagnosed as not having inflammation, you need to be at 50. If you're at 47 or 48 or 49 or 50, you don't have inflammation. But if you're at 51, then you have inflammation. Okay, so it's a lot of it's to do with the degree. Okay, so that's something that we also take into consideration. So anybody want to put forward an idea as to what might you do to help reduce your inflammation? Naturally. Not cortisone.
Anti-inflammatory.
Which is like what?
Blueberries, strawberries. I'm lost.
Okay.
Along those lines.
Yes, absolutely right. So, but they are the sweeter fruits that we're talking about. Okay. What about other products that you may be able to take that are anti-inflammatory?
Ginger.
Excellent. So ginger, turmeric, with black pepper, that type of thing. And anybody know a common essential nutrient that is required for us to exist that we should all get checked? Water, yeah, hydration goes without saying. Honestly, like that's like that. Yeah.
Protein.
I'm talking about from not a supplement. You might think of it as a supplement, but it's actually an essential nutrient.
Sorry?
Omega-3. So fish oil. Okay? But you've got to take the best quality fish oil, and you've got to take it in the right doses as well. You can't just take what it tells you to take on the side of the bottle, because on the side of the bottle it's going to tell you to take a quantity that is for someone who's 4 foot to someone who's 7 foot, and not necessarily as inflamed as you are as well. So you've got to take the appropriate amount. So, that's really, really important. You take a very good quality product, which we've researched and we've looked at, and also that you're taking the right dosage of the product. That goes for anything, okay? What other things can you do with your nutrition? What other supplements may you take that would be an essential at this time of year? Hint, hint.
Vitamin D.
Excellent, right. So vitamin D. D3 with K2 as well. Okay, that's really important for you to be looking. And again, not just, home bargain style, something that's got 200 IUs per one tablet. It's not even going to hit the size. You've got to take high doses of your D3 with K2, okay? Anything else that you may want to look at nutrition-wise? So omega-3 we've talked about in terms of an essential, same with your D3. Where else may you be able to get some of that omega from as a part of an anti-inflammatory diet? Fish, oily fish. What's an oily fish? Mackerel, salmon, that sort of thing, okay? What about a reduction? So we talked about an increase of stuff. What made you want to look at reducing in your diet? Sugar, amazing, because that we know increases your inflammation generally within the body as well. Okay, so sugar is a really important one, which is why it is the young lady in the beige top there, which is why it is that when we're talking about the fruit, you're not talking about taking on a mango, which is super sweet. You've got to look at something which is actually low sugar, which is why it is that the blueberries are amazing as well, okay? And so reduction of sugar, and do you know what a lot of people do when they reduce sugar? Like, let's say that you take away your spoonful of cane sugar in your tea, what might they replace that with? A sweetener. And guess what? It's actually worse than the sugar. It's worse than the sugar because it's a toxin within your body. So because of the fact that you're taking that on board in many, many different formats as well, not just in your tea and coffee, you might have it in your drinks, in your cordials, in things that say that there's no added sugar. Start looking at your labels for that kind of thing.
What about honey?
It is, unfortunately, it is in those individuals that are sensitive, it will give you a glucose spike, so it's not the best thing for you to be taking regularly. Alright, so I wouldn't take it, not if you're inflamed. If once a week you have it in a cup of tea and you don't have any other issues, you're not going to have a problem. But if you've got an issue, you need to look at something else. Okay, so who's learning something so far? Please engage. Thank you. Okay. So D3 magnesium you talked about as well, which is usually low in someone with fibromyalgia because of just the heightened tension that you're going to have in your body. And we've already talked about the omega-3. So some studies have shown that like a vegetarian diet may be applicable as well. Not so sure about that. It's just again about reduction of inflammation. And anybody here vegan? No? Goodness for that. And only because those that are on a vegan diet, they have no issues with something. Number one, we've always found them to be super, super, super low in omega-3. because they're not taking on board the correct nutrients from animals that sometimes you do need. But number two is the junk that some of them eat, because of the fact that they're not having a carrot or a potato or something else, they're having some kind of, whatever. That's the problem that I've got, is just that if you're going to be vegan, then do it naturally as opposed to eating loads of sweet, artificial, because you start reading the back of labels of products that people are eating. It's craziness. So, we also know that vitamin D is also, what does anyone know what it's called, what the other name for vitamin D is? It's not actually a vitamin, it's a like product. It's called the sunshine vitamin. Okay, so I think you'll all have heard of that. So because we tend to get it in the summertime oftentimes. Again, there's caveats with that is that not everybody will get the same amount when it is that you're out and about in the sunshine, because you have to have your body exposed and you have to have no lotion on, etc. to actually absorb the vitamin D from the sunshine. So we know also that getting your products, like I've just said, from somewhere like Holland and Barrett or Home Bargains across the road there, you're just not going to get the quality that you really need to be looking at, especially if you're trying to treat something, from within. Does that make sense to everybody as well? I had a conversation with a patient yesterday who said, I take all of my new supplements from Holland and Barrett. I said, as long as they're not Holland and Barrett's own label product, then you'll probably be okay, because some of the ranges that they stock are very, very good. But I always question, if you've got a sale on and you can buy that same bottle that you normally pay £20 for, but you can buy it for a penny, that I always question that. Like what's the affordability with that? What is going to be the quality of the product? So you want to make sure that your supplements and your essential nutrients are good quality.
How do you know what doses you're supposed to be taking?
You need to speak to me about that at the end.
Okay.
Okay? So, we've talked so far about emotional stress and we've talked about chemical stress. Next up, physical stress. Okay? So, would anybody consider exercise to be a physical stress on your body?
Yes.
Yeah, okay. It's particularly important for you to do the right type of exercise when you've got fibromyalgia, because you've got to do something, but if you do too much of something, then what happens? Absolutely, you kind of you think I'm full of beans today, I'll go off and do this whatever distance walk or whatever you decide to do, and then you kind of paying for it later on. Does anybody know why that might occur?
Is it PEM? Something like that.
Explain to the group what that acronym stands for.
I can't remember.
So there are many different. I'm not going to go further in that either. But I think the thing is that you've got post-exercise soreness that you experience, which was called post-exercise DOMS. Anyone heard of DOMS? Delayed onset muscle soreness. So we don't actually know why it is that people get that, but we're thinking that it's to do with microtrauma within the muscle fibre, which is why it is that can occur. Again, it's a fine balance between doing something that's going to be beneficial to you, not put a huge amount of stress on your system, and doing something that's going to create an improvement in you, because your body actually craves movement, but you don't want it to be too stressful on your body either, because the delayed onset muscle soreness has a component of inflammation associated with it. So that's why it is you've got to be really, really careful with the exercise that you choose. So what might be a good exercise for you to do? Swimming's great. Okay, and what about if you can't swim? Yeah, in the form of postures and movement, yeah, and Pilates. What if you haven't got access to yoga or Pilates? What else could you do? Stretches, which is the yoga and Pilates. Walking. okay? And you'd be brave to do it in what we've had today and yesterday, but you know, it's definitely something that you should be getting out and doing because, and it doesn't really matter the time frame, but it does matter that if you say that you're going out for half an hour walk, that you're not just doing it in 5-minute intervals. Like, I did 5 minutes this morning, and then I did 5 minutes, you know, at 11 o'clock. And it's kind of got to be done all in one go. So I'm not saying that you go out for an hour. What I am saying is that if you are accumulating it, that if you're reporting back to someone, you don't say, oh, I did an hour, and actually you did 5 times 12 sets of. Do you know do you understand where I'm coming from there? Is that you've got to do it all in one go. So Tai Chi, yoga, Pilates. So if you so the yoga actually, although it feels like it's an exercise, it's actually originally works with breath work. Did everybody know that it's actually concentrating on your breath work first, and then later down the line, the movements and the postures were introduced. So how does the exercise work? So I want you to think about stress and exercise now. So what I want to get you to do is something a little bit interactive. I want you to hold your hand out in front of you, right or left, it doesn't matter. And I want you to make a fist for me. And I want you to squeeze that tight. Squeeze it. Squeeze it. As hard as you can. Keep going. Squeeze, squeeze, squeeze. Squeeze. And now relax. Okay. What happened to your breath? Okay, so you thought it was about the hand, but it wasn't. It was about your breath. Okay, so your breath, that's what happens, unfortunately, when we're doing exercise as well, is that the contraction affects your breathing, and the breathing can actually have an impact on inflammation levels as well. Okay, so we do have techniques that we do give out for something called box breathing. Anyone heard of that?
Yes.
Yeah, what is it? Do you know what it is? You're going to volunteer?
It's an app, isn't it? It's on your phone.
It's not necessarily actually even, it can be an app.
You wait,
I
you
don't
hold your
know.
breath and then you wait and then you exhale.
Breathe in for 4, hold
Yeah.
for 4, let out for 4, hold for 4.
Exactly right. So it's in a box. So 4, so in, hold, out, hold. Okay? It's where the inhale generally is shorter in total than the exhale or the hold. Because you're only inhaling for 4, you're holding, you're out, and then you're exhaling. So all of that is more out than it is that actually is coming in. So that's how that works. Now you know. Okay. So aerobic exercise and weights. Is that any good to anyone, do you think? I'm not somebody who's really, really acute with fibromyalgia. I think it does work, but it is, you have to go light. You have to make sure that you're really not pushing yourself, especially when you're super inflamed. What were you
I
going to
do
say?
it all the time, 3-4 times a week.
And are you on medication?
No, don't
Good.
take medication.
That's brilliant. That's brilliant. So what I'm saying is that if you're very acute and super inflamed, you can't be hitting the gym full call. But if you're not as acute, it will help to keep things at bay.
I was told to do aerobics is a lot because you're weightless.
Because exactly. The problem with that is for over a period of time, is that if you're not doing anything for your bone density or weight bearing, then it's going to have a negative effect in the long term.
Yeah.
That's the issue with that. So ultimately, you want to be doing a variety of different things. You don't want to be doing just one thing.
What about the chair-based exercises? Do they use?
Absolutely brilliant.
Yeah.
Really, really good. I think that, as a starting point, so good. Any kind of movement that you can do is going to be helpful. Anything that you can do. Okie dokie. So I'm just going to go and get a quick drink from around the back there. I'd like you to just chat to your neighbour about anything that you feel that you've picked up so far and what it is that you potentially could do differently to go forward with your fibromyalgia. I'll be back in one moment. You need to chat with these at the front.
Once you found the formula to thoroughly for the following year.
I'm alright, I've got the
Get back into the room. Thank you. Okie dokie. So, anybody got any insights that they would like to share? No?
Chairs are uncomfortable.
You won't be here for too much longer, don't worry. Okie dokie. So, one of the questions that we always get asked when I do, because I think this is at least my third talk that I've done on fibromyalgia within the last 12 months or so, is why is it a chiropractor is talking to me about fibromyalgia? Anyone thought that? Yeah? So, it's not about your bones, actually. It's about what's inside your head. What lives inside your head? Your brain. Okay. And does anybody know why it is that your brain is important?
Send signals.
Because your brain controls everything else within your body. Okay, so a lot of people will often say, oh, it's your heart that is the most important system within your body, but actually it's your nervous system. Your nervous system is the most important system within your body, because without it, nothing else is going to work. So like I was just saying before, it's like the conductor of an orchestra. So without the brain sending the messages through to the body, and the body kind of sending those messages back up to the brain again, you're going to have stuff that's going to work, but it's going to work of its own accord. So this is where it is that when we were talking about trauma and your body, where the chiropractor and our speciality comes in. So you talked very correctly about the fact that you think that you go to see a chiropractor for your bones. Why do you think people might think that? No, don't tell me because you've seen it on TikTok either.
People I know with back problems, specific.
Okay. Absolutely. So that's what it is that we are known for. But that is because, where is your spine? It's your back. Right? So because we are taking care of your nervous system sits, so your brain sits inside the skull here, but your spinal cord sits inside your spinal column, your spine. Okay? So when you have an issue with the signaling between the brain and the body back up to the brain again, oftentimes you will have what we call an irritation or a limited movement within the joints of the spine, which then compound that irritability in terms of the signaling. Are you following me?
Yeah.
So this is often the reason why it is that when we talked about an emotional trauma that somebody may have had, it can often be linked to a physical situation too. And what we find is that when we release the physical element, the emotional element also releases. So there's many, many different ways to deal with the same problem. As you know, there's more than one way to take care of something. So that's where it is that as a chiropractor we come in, which is looking at your nervous system and making sure that your brain is communicating correctly with the rest of the body and the body back up again. Because a lot of times that immobility in the joints of the spine creates inflammation. And the inflammation then compounds an irritation that you may have, which then leads to, because of the way that your particular body works, you may be, like we said, a little more sensitive than the next person, not because of your genes, but just because of that's the way you work. It could be related to the emotional trauma too. You're sensitive, so your body then goes into a downward spiral with that. So somebody else who trips over and falls, they can recover from that, and somebody else who has an issue with regards to their sensitivity, they will take a downward spiral from that and end up with a situation where you've got something where you end up, a little bit later down the line, you end up with a diagnosis of fibromyalgia. And for some of you, it will have just come out of the blue. You won't be able to connect it to anything. But what we always do here is look through, when we're doing a case history with you, is look to see is there a physical trauma that you can think of that could have contributed towards the onset of your symptoms? Is everybody following with that and why that might make sense for you? Okay. So how is it that we work here is that we take care of, like I said, hundreds of thousands of people. But, I don't have to run these free workshops, but we're doing it almost like as a public health service because of the fact that we know that it's so taken care of by other areas. And what we also know is that a lot of people are looking for a natural solution. So I really wish that the current patients that I've taken on board who have started with me, I think there's a lady who's definitely a load of patients who started with me in March. They are absolutely flying, not high on whatever, but they are flying because one of them said to me on Monday, she said, I went back to my GP and she said, he can't believe how I'm moving now. And he's actually said, I don't even think you've got fibromyalgia. And I said, I agree with that. I think you've been misdiagnosed because she had a trauma, and she had a fall, and that's why it is that she ended up with the situation that she had. So it's a diagnosis, but do you not think that you get labelled with it as well, and therefore everything that you've then got, even if you've got a cold, it's fibromyalgia. It's fibromyalgia.
I think, personally, that if a doctor doesn't know what's wrong with you, can't pinpoint what's causing the problem, well, like we used to say years ago, oh, she's just and she's just a woman, she's just crackers, just data.
So you will get that, but then I think the other issue is that your GP, if you think about their training, they're trained in looking at your organs. They're brilliant at that. Like if you've got a liver issue, kidney, whatever, don't come to me. Like I'm going to send you off in a different direction. However, if you've got something that is more psychological, or something like this which is pain-based, you get sent to a pain clinic. And what do you learn at the pain clinic? You learn how to manage the pain. What are you doing for the actual pain? Apart from, you need to take your medications on time, you need to get out and do your movement. Are they talking to you about any nutritional approaches? Are they talking to you about...
come off the medication before they'd see you.
And I understand that because they want to look to see whether something's masking it or not.
because he wanted me to come off everything.
And
But
that's
I'm on
No,
lupus
that's what-
medication
that's
as
what
well,
it's
so
like.
if I came off that, I'd end up back in
Craziness.
hospital. So.
I understand. So I think, because the other thing is that what we also need is a bespoke approach as well. You can't be the same for everybody. That's the other issue that we have. Okay. So I'm just giving you examples of people that we have taken care of here who have followed what it is that we've recommended and have had outstanding results. Has everybody learned something? Yeah? So, anybody want to give me like a brief synopsis of what it is that you've learned?
And exercise is a good exercise.
Yeah.
Brilliant.
And it's
and
nutrition as well.
Nutrition is key, absolutely. So the other thing that we have available for you to try is we've got a product called Basica, which is also helps to reduce inflammation. So we've got a little container up there, and we want to help you, so we can get some cups. Cups are available at the side there.